Welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. Doctor, are glaucoma a silent killer? My first question for you is, what are the early signs for glaucoma and how can it be detected before any significant damage occurs?
So we need to know certain risk factors. So generally, some patients are at a high risk to develop glaucoma. So these are like family history. Patient who have glaucoma patients, their siblings need or blood relatives have to have their eyes checked frequently because glaucoma has a genetic tendency. And age above 50 years, 45 or 50. So age itself can lead to certain glaucomatous changes. Asians are more prone to develop glaucoma. By the genetic nature, Asians and Africans are more prone to develop glaucoma. And people who are having minus power, so those who are wearing glasses, so they and people who have diabetes, all these patients have very high risk of developing glaucoma. So while glaucoma can't be prevented entirely, progression can be slowed through few other ways. Right? So these patients have to undergo a regular eye checkup, so which includes eye pressure measurement, the nerve examination, and field testing, what we call as perimetry. So these three are important, and nowadays there are non-invasive imaging method like OCT, which is nothing but scanning of the eye nerve, so where we can detect the glaucoma at a much earlier stage. So a regular assessment and regular eye examination can help the patient to detect glaucoma. If they have, it can be treated well. If they don't have, they can be at ease and be happy about it.
What are the risk factors for glaucoma and can it be prevented or slowed down with the lifestyle changes or medication?
Yes. See, the risk factors, I think I've already told you, the family history and the patients with high myopia, diabetes, and Asian origin, and the people who had any injury, and people tend to have medication from the medical store or from unqualified people, so who do prescribed a medication called steroid drops. So these steroid drops can also induce eye pressure or glaucoma. So you have to be aware of this. So prevention is understanding this, knowing these causes, and trying to prevent these. Of course, genetic part cannot be prevented. So those patients have to take care of the eyes by regular eye examinations. So the management part now with a lot of advanced medications are available. So previously only surgery used to be a main method of treatment. So nowadays with the medications, eye drops, we can manage glaucoma very well. So there are a lot of good new eye drops are available to help in the management. So all they have to do is detect at an earlier stage and start using the eye drops. And now new method laser treatment have come. This again non-invasive, can help to reduce the eye pressure to a greater extent and doesn't cost much. So now again micro-invasive glaucoma surgeries or minimally invasive glaucoma surgeries are available. So now the treatment is wide with new advances, new therapies are coming up. So all the patients who have glaucoma, all they have to do is undergo a regular eye examination, stick to the medications given properly, and follow the regimen, whatever the doctor prescribes, diligently. So in that case, they can easily control the glaucoma and prevent vision loss. And so blindness due to glaucoma has to be prevented at any cost. The patient have to be aware. With science expanding, a lot of treatment options are available. So people have to use the science to see the world better.
Agreed, doctor, what you said. How often should I get my eyes checked for glaucoma, especially if I do have a family history of the conditions, doctor?
Okay, so those who have high risk factors, so every 2 years. With no risk factors, every 2 years, a regular eye checkup is essential. But beyond 50 years, if they have additional risk factors, every year eye checkup, including the eye pressure and optic nerve head assessment, is necessary. And beyond 55, it has the frequency have to be increase. So every 6 months, we would advise people who have more risk factors. For example, patient who's a diabetic, who already wearing glasses, and family history, they need to undergo checkup at a much frequent, say 3 to 4 months. And those with risk factors have to have a proper glaucoma examination at a not only frequently, but also ensure they do all the investigations properly. Very, very important, because just checking the eye pressure may not help the patient. A proper full glaucoma assessment is essential. So, basically what we say is check. So check means calendar regular visits, and H for history, and E for early detection is crucial, and C is counseling and communication, and K is keep the pressure control. So this mnemonic, so I tell my patients to have this at mind, so that they can also share the information with their family and friends.
So doctor, your expertise and insights on glaucoma, a silent killer, are invaluable to this initiative, and we believe your participation will greatly benefit the patients.